I am so excited. As always, we have a very, very special guest who I know is ready to have some candid conversations, particularly around Black youth, violence, and mental health. But before I do that, I always want to remind you all, every week we are meeting at 8:30 for 30 minutes just to hold the space to talk about issues that are impacting some of our most vulnerable. I don't want you to miss a thing. Don't want you to miss a thing. So make sure that you turn on your notifications so that you can join us live. Career community, it is so good to see you. I see you, Olivia. Good to see you as well. All right. Should we get into it, Akwatu? Should we get into it? I have to give the bio first.
All right, no worries.
All right, you ready? All right. All right. And again, thank you so much for joining us this evening. Thank you very much. Akwatu Khenti is an assistant professor with the Dalla School of Public Health at the University of Toronto. Dr. Khenti has over 25 years of experience in government and community settings. I see you have a lot of love. You got a lot of hearts. You got a lot of love there. He is the former Assistant Deputy Minister for Ontario's Anti-Racism Directorate, Cabinet Office, and Director of Transformative Global Health at the Center for Addiction and Mental Health. Dr. Khenti led CAMH's development of a specialized drug treatment and prevention program for Black youth in Toronto, the substance abuse program for African and Caribbean youth, and more recently chronicled the effects of social determinants on racialized gun violence in Toronto from 2004 to 2014. Dr. Khenti has also led a wide variety of international initiatives to strengthen mental health and addiction in primary care and to reduce stigma in healthcare. He was a researcher on the development of culturally adapted cognitive behavioral therapy interventions for Latin American and Caribbean populations. This CBT intervention has been applied with Voodoo spiritual leaders in Haiti to test whether it can strengthen the system of informal care. I mean, Crib community, you know I'm gonna ask of you to greet Dr. Khenti like nobody can. Crib community, let's show Dr. Khenti some love. Yes. Welcome, and thank you again so much for joining us tonight.
Yeah, thank you. This is my first Instagram interview.
I mean, you've got the frame. Listen, the Crip community is laughing at me. I'm still working with no background, no. So you're perfectly framed. I can hear you perfectly. So we're good to go.
All right, no problem. Okay.
All right. So, I mean, just an illustrious career, really dedicated to really addressing issues and providing mental health services, in particular to African, Caribbean, and Black folk. Can you share with us tonight what drew you to this work?
Well, a couple of things, odd stuff actually, because I was very much involved in protesting police shootings of Black people back in the 70s and the 80s. That seems like a lifetime away. And I actually became demotivated to keep doing that because of the growth of this pattern of shootings and the fact that we couldn't do anything about it to stop it, and I was just like everybody else, which I tried, I participated in joint initiatives with churches, and I even have to organize conferences with the police, but so I sort of stopped focusing on it, and I had an incident that happened to me that sort of told me this thing had gotten out of hand, and I was part of the problem. I was riding my bicycle home one day because I used to ride a bike. Actually, I still ride bikes. Anyway, these brothers in this SUV started following me. So I ride my bike, I turn a corner, they turn a corner. So I'm starting to get scared because I'm wondering why these guys are following me. So finally, you know, I stopped because I'm like, I went about 3 blocks, they still followed me. And I kind of got scared because I didn't know what was happening, what was going on, right? And this was around the same time, same kind of situation. Anyway, they pull up next to me and say, and the guy in the passenger seat says, you know what? I know you, man. I saw you riding that bike. I swear I know you. You used to play soccer down by Overly, right?
Okay.
I said, yeah. Long time ago. But, you know, I realized that the stigma towards black men, young black men, was so powerful that even someone who was African-centered like myself could fall prey to the fear, the stereotyping, and the miscalculations that often lead to problems. And I decided I had the problem was so great that it engulfed me. So I had to work my way through this and actually, you know, create some internal balance. And that's actually when I started to write about the topic.
Internal balance. But the power of the narrative, the power of it was a turning point for you. Wow.
That's correct.
Wow.
You know, because you see, you're part of the problem because you're now afraid of your own. When you're afraid of your own, and like I said, if you're afraid, I always used to say, if you're afraid of a student, you can't teach that student.
Ooh, that part.
So that's reality. But if you're afraid of someone who looks like you, your brother, out there in the street, what does that mean? For trust, for cooperation, for community building, all that stuff goes out the window. And you know, that became sort of my motivation to sort of refocus some of my academic effort. Wow.
Thank you so much for that story, for that telling me about that experience.
No, it was a seminal experience.
Yeah.
Seminal experience.
So throughout your work, you've discussed how the persistent rate of violence among young black men in particular has elicited a fair number, to your point and description, of criminological analysis, but very little public health research. Can you tell us about the importance of approaching this issue through a public health lens and walk us through what a public health approach to this phenomenon should look like?
Right. So I think the public health approach begins with a social determinants analysis, which shows you very clearly that the disparities in income, education, environment, care, the healthcare access that one has are too great for low-income black people, especially low-income black families which involve one parent. It's so hard to raise children with 2 parents in this society, much less when it's one parent doing it by themselves. So the social determinants of health perspective really grounds the analysis, but we also have to look at the incarceration rates for things that white people get a pass, particularly cannabis arrests and the cannabis arrests, cannabis use and cannabis abuse, even some aspects of trafficking are a public health problem. It's not a criminological problem. And you know, that was before it was decriminalized, even more so now. And we have to look at the incarceration rates, the criminal justice interaction of all aspects of the criminal justice system with black children, youth, and young adults, which actually sets them on the path from school or social life to prison. That has to be interrupted. That has to be disrupted. We have to look at alternatives, expansion of alternatives and violent prevention, diversion of mentally ill, expansion, what they call therapeutic jurisprudence, where you can actually look at the background of individuals and find alternative ways to deal with them. Not just because the criminal justice system doesn't heal anyone. It only makes things worse for the people involved. We need better mental health in jails and prisons. We need to improve re-entry and rehabilitation for young Black men. And
Yeah.
we particularly need stigma reduction efforts in our community, because one of the mistakes that many parents make early on in the interaction between Black youths, Black children, and the system is to leave them to fight it on their own. A lot of you won't believe how many Black parents don't show up in court because they said, I tell you, don't hang out with those people. I tell you, don't do that. I tell you, don't go there. You go there, you're on your own.
Yeah.
That is a sentence, that attitude, sentences, practically sentences our young people to fates, which seldom, is related to what they're in there for.
Yeah. You've mentioned so many things, and I just want to circle back to some of the gems that you've uplifted this evening, particularly around an understanding of anti-Black racism as a social determinant of health for Black people. That is central. That is central, and that the racism it permeates through our structures, right? But that we also internalize some of that. The other issue that you brought up is around mass incarceration. And I think, and I truly, truly believe that in addition to the racial profiling that contributes to mass incarceration, right? Once we have a disproportionate amount of Black and Indigenous young men and women behind bars, we don't take the time within a system with a mental health lens to really unpack the trauma histories of folks, to really understand, what's happening there. And I think that that's what you're sort of touching upon, right? That we don't provide care, we don't unpack what's happening. So the high likelihood of recidivism and so forth and so on continues. So there's so much there.
Yeah, but even before that, the interaction with young people, with children, and and teenagers, that interaction has psychological consequences. And the repeated interaction
100%.
Is huge. And we haven't researched it here in Toronto, but I remember reading some papers from Florida where the authors, I think it was Jones, showed that after a sequence of interactions, young males actually take on some of the habits. It's like being a hostage, where the hostages end up like relating to the hostage taker.
I understand.
So the person who is at the receiving end adapts some of the behaviors of the person who is depriving them of their rights, interrupting, showing them power, force. And that's how you learn that when you have power and force, you can influence other people's lives unjustly. And you take a page from the book of the people who do that to you, and you can't do anything else. And you take a book from their page and apply it to people who are in your circle, who you could interact with, who you could influence. So I'm big on trying to reduce all interactions with our young people, because it's all negative. There's nothing positive coming out of it. So.
Power. Interesting. So I want to segue a little bit deeper into some of the things that you've mentioned just now. Last week, my guest, Julius Hagg, and I discussed the hyper-localized nature of gun violence in Toronto. Quite often, when this topic comes up, the conversation gets reduced to Black on Black violence, ignoring the root causes of fatal and non-fatal firearm injury. What are some ways that we can begin to talk about anti-Black racism as the root of structural violence that ultimately contributes to the overrepresentation of young Black victims of gun violence? That's my first question. I'll stop there because this is a lot.
Yeah, it's a big question. So I'll answer it simply. I argue that the term itself, Black on Black violence, tells you everything you need to know. Black on Black violence, for me, reflects the implicit bias in the system against Black people, and the very idea of Black victims.
Thank you. But, wait,
because
I got it. Well, that was a mic drop moment. 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 Can you say it again? Go ahead.
But I think that the concept of black on black violence itself reflects implicit bias and suggests and implies and actually says it out that we have no victims.
Right.
That the Black victims have agency in the situation that leads to their mortality. The Black victims are always responsible for their death, or maybe have some kind of a criminal pattern or something like that. So that there's no innocent Blacks. There's no innocent Blacks. They're all guilty.
Right.
And when you use the term, really what that term does is remove from the person who is hearing it, seeing it, talking about it, the responsibility to even be upset at the loss. Like we recently lost 2 innocent brothers in 2 months.
Yes.
And their innocence was notable because of the work that they did and their involvement with the city. But 85% of the young Black men who are murdered by other young Black men are innocent too. You know, a woman named Sarah Thompson did a study of the homicides from 1988 to 2003.
Yes.
And only 15% of it was illicit activities. 15%. 85% of it was beef, anger, escalatory violence, unplanned violence.
Yeah.
I mean, like bus-stop violence. One of the most striking phenomena is the bus-stop violence, where eye-to-eye contact leads to homicidal violence. I mean, yeah. So black-on-black violence is a concept to be deconstructed and rejected.
Thank you. Thank you.
And I always tell people that's a non-starter for me, and it should be a non-starter for any of us, because if we have black on black violence, we got white on white violence, yellow on yellow. It's really ridiculous. That part.
Right. And research indicates that statistically that there is interracial that violence. That's across the board. That's across the board. But you don't hear white on white violence, right? You don't hear that sort of construct. So thank you so much for addressing that. I want to also piggyback on this and ask, one of your research interests talks about community interventions to reduce youth violence. What do or should these community interventions look like?
Right. So, there's a variety of along a continuum, from an adaptation of the cure violence method. That's a public health approach to gun violence that seeks to change individual and community attitudes and norms about gun violence. And it actually looks at gun violence as analogous to a communicable disease that passes from one person to another person when left untreated. I believe that has a place. Although it has a place, but it's not the only place or the major place, because it's something to deal with the situation that we have now. We hire people, we send them out there, we find out who's upset with who. They go to emergency rooms when somebody gets shot to talk to the families to sort of bring things down. That's dealing with the immediate, because you got to deal with the immediate. They deserve health responses. But that immediate also is a contradiction, because the immediate suggests the problem resides in the people who are involved in the violence, when it doesn't address the structural violence, which creates that individual acts of violence.
Yes.
And so we have to have a program that sort of insulates or inoculates our young people from the structural violence. The only way to do that is to have comprehensive early childhood education, including home visits, caregiver support. We need to, being a parenting anti-racist parenting is expensive and comprehensive and demanding, and we need it. Because the people who are the poorest segments of our population need the most resources, because they face racism in ways that others don't. But also with less resources to address it, and because of it, they get overwhelmed. They're defeated by it. So many people are defeated by it. And
what you're talking about in terms of the focus on prevention and intervention, yes, that we need to have resources that are focused on the crisis. And for those of you who don't know about the Cure Violence model, it's a public health model that is used widely throughout the United States. You may have heard me mention Safe Streets in Baltimore and Chicago and New York, an incredible program that really uses violence interrupters, individuals who have either been from violence, been raised in violent neighborhoods, or have been formerly involved in a life of crime and have turned their lives around and are credible messengers, if you will, that are working the streets at the peak hours when violent crime occurs to intervene. But it's so important, you're absolutely right, that both policy and structural issues need to be addressed while delivering the inoculation, if you will, almost. Delivering the inoculation. So
vaccination,
important.
social vaccination.
Yes! Oh my, oh, that's it. Social vaccination. Okay, you heard it here first from Dr. Khenti. Social vaccination. Social vaccination. I love that. Love that. In your report, and I just want to thank you, when I first started sort of doing my research and in preparation for my job talk and coming here in 2018, your work was some of the seminal work done here in Canada that I began to read, particularly addressing and talking about homicide, violence, and victimization, and the trauma that it leaves in its wake. So I just wanted to acknowledge that publicly. Thank you for doing that work and shepherding that work as a seminal leader here. Thank you so much for that.
Enough respect.
But in your report, Black Community Town Halls Unpacked, you discussed the disproportionate reality of addictions and mental health problems that go unaddressed due to a lack of documented research, lack of services, and delayed help seeking for Black youth in particular. What are the causes and consequences and solutions, if I dare, to addressing addiction and mental health for Black youth? And I think you've touched upon some of those issues, but I just wondered if you could circle back and put a nice bow on that particular issue there.
Yeah, so what COVID has done and the vaccination debate has done is give prominence to the historical mistrust that Black people have towards the medical system, towards doctors, that they feel anything is possible. And for me, the learning is, wow, we always thought this like this. We didn't just start thinking like this in 2020. We were thinking about this like this in 2010 and 2000 and 1990 and 1980.
Right.
And
Right.
As far back as you go, and it brought me to that book, which I had read a long time. I read in 2005 about the post-traumatic slavery syndrome. That because of the trauma that we inherited from slavery, and it's multiple traumas. It's the kidnapping, it's the slave ship, it's the breakup of the people. So they broke you up when they landed. You had bonded during the trip, the Atlantic trip, the Atlantic hellhole, and then you land. And they break you up. So multiple traumas along the way, and unresolved traumas along the way. We survive because we oriented to survival. It's all about survival. It ain't about delving deep into what this means for my community, what this means for me. We've never really had the capacity to do that until the 20th century. And we have lots of unresolved trauma, which creates a lot of mistrust that prevents us, some of us anyway, from taking our health seriously, paying attention to our bodies, paying attention. We somatize everything. So because of that, we don't pay a lot. Well, some people are ahead of everybody else. I'm not talking about the exceptions. I'm talking about the rule. But it's physical illness or mental illness. We delay help seeking. It gets severe. We end up in the emergency room. We end up with severe health consequences of things that are preventable, from cancers to addictions. And so the easy way or the immediate way is to sort of provide culturally appropriate treatment. But in the long term, we have to understand this trauma that for us, I mean, I don't even call it intergenerational trauma in the same way as it is for indigenous people, because we're exposed to so much anti-Black racism in our non-verbal years. That's the sort of the bridge that tells you Black is bad, Black is ugly, Black is this, Black is that, Black is that. All part of the Western project. And we have to unpack the historic baggage that we have so we can leave it behind. We have to learn to appreciate the resiliency that allowed us to survive. Like James Baldwin said, I'm an optimist because I'm alive. And, you know, we all have to be optimists when we look at that slave ship and see, how the hell, telling you how the hell did we survive that ship? God said, you know what? Your time isn't up yet. So hold on. Hold on. And so we have a lot of challenges, but we also have a lot of strengths. And the bottom line is we need to take our health seriously, because our health is our wealth. Our health is our equity. In a society that doesn't foster or nurture our ability to accumulate capital, our health is our equity. We have to be healthy because we can afford to be healthy. And unfortunately, not understanding how racial microaggressions and racial macroaggressions, in addition to macroaggressions, which weathers us down biologically. And makes us susceptible to all those chronic illnesses with COVID likes.
You have dropped. So let me just say, I just wrote down anti-Black racism is the virus, and then the social vaccination is I'm just all over the place with what you're saying. I'm writing it down. But also, what you're saying really leads me to believe, and I truly believe this, that there really is no post-traumatic anything for Black people, because we're still not free. I mean, let's be clear. The conditions are of abuse are somewhat different, but we're still not free, and so there truly isn't any post. But I love the fact that you talk about, you know, health as our collateral, you know, health as our wealth, and viewing it from that lens is so empowering, in the sense that it suggests that we have to somehow figure out, both on a policy and structural level, but both demand that our health and our wealth takes precedence. So wow.
And because of I actually believe that the reason I'm successful in my life with the limited resources at my command is because of my early years in Trinidad. 1 to 11 in a poor neighborhood which had incredible social capital, but we don't call it that. But anybody could cut your ass, as we used to say. I got licks from all kinds of people. Family, people who knew my family, but people who didn't even know my family. And that people would report on me if they saw me, hanging out, skipping school or whatever. Somebody would go back to my mom and tell her, I see your son on Charlotte Street doing this and that. And there's a lot of informal social controls in these poor neighborhoods, which are actually what people today call social capital. We had a lot of social capital. And somehow the war on drugs, and by the way, the war on drugs, which has been exported globally, so that even in Black countries, you have people fighting the war on drugs the way it's fought in America, criminalizing Black men in the same way, even though the players seem to be different, but the outcome is the same. Who ends up incarcerated is the same. Anyway, the point I wanted to make is that we have a lot of wealth in the way we live as African people. And we've allowed that wealth to be diminished through the process of integration. You know, this is my book. This is Francis Kressing. The way I understand Francis Kressing is we need to decode a lot of the things that we've given up as well as the things that we've taken in to see, has it worked for us? Does it work for us, African people? And if it doesn't work for us, why are we keeping it? Why do we allow our children to be socialized according to values that don't mean nothing to us? I'm telling you.
Wow.
I see people let their children call adults by their first name. I say, no, you can't call them. My kid, you're not allowed to call anybody by their first name. Any adult by their first name.
That's how I was raised.
I'm telling you. You talking to them like if they're their friend.
No.
Anyway, the point is, African values are protective values. And Eurocentric-based values are actually risk factors for self-esteem problems, risk factors for getting lost amidst an array of racial stigma and self-fulfilling prophecies that have you going nowhere. And I believe that we can do it. That we have African-centered resources now. There's actually no excuse for us not tackling some of the self-esteem problems. And it's cultural self-esteem, it's not individual self-esteem. We don't have a problem of individual self-esteem. We have a problem of cultural self-esteem. And that's what we have to address.
Interesting. So I wanna touch on that point when you said Afrocentric sort of services, and people are asking all kinds of questions in the chat, has it worked, so forth and so on. But because you've adapted, you've done some cultural adaptation, and I'm conscious of the time, it's 9:03. So earlier this summer, the CRID launched Invisible Wounds, a community engaged project aiming to build a conceptual model from the voices of African, Caribbean, and Black survivors of homicide victims that can inform the development of future culturally responsive interventions, to your point. I want to know if you can talk a little bit about your work adapting Western mental health modalities to be more culturally responsive to Black folk.
Yeah. So, I've adapted cognitive behavior therapy approaches to alcoholism, children alcoholism treatment. I've adapted some prevention strategies, and I've actually now begun to look at the stages of bereavement and grief, because while we grieve sort of similarly, it's not the same. And acceptance is not the last stage of Black bereavement. It's not a question about acceptance, it's a question about surviving and going on to a higher level, understanding what's the issue, Right. And I think that that's an area that's going to be a real, we have huge gaps, and coming out of COVID, you know, you thought you were low, you thought you had hit rock bottom, but COVID interrupted the way Black people die. We don't die, but the way Black people die and the way Black people grieve, and especially the way Black people who have lost children to gun violence grieve, because their grief is, the legitimacy of their grief is diminished. Right. Not just because of the wider society, but also, and the police, but also because their own community
can't gather
back them on grieving. Because grieving in Black culture is a public affair, it's not a solemn, silent thing. We grieve through 9 nights. You know, in Trinidad and Jamaica and Haiti and Barbados, they got 9 nights, and during those 9 nights, people come over to your house and eat your food, drink your liquor, but actually walk you through back to some degree of normalcy, back to some of, that's where the acceptance takes place. But that's actually the beginning of bereavement, because a long process, and in Africa it's years.
Right.
Years. They have 10-year celebration after the death of someone, 1-year celebration, and some people never stop grieving. But I think the COVID interrupted the way we grieve, which is a social process.
Yes.
And that's going to add more trauma onto COVID trauma, onto being the George Floyd trauma. I mean, it's just trauma upon trauma. And of course, we still face anti-Black racism in education, in employment, in criminal justice. So you got to see that it's a lot for any individual, it's a lot for any community. No wonder we are struggling to make sense of the whole thing.
Yeah, I refer to what you're talking about as the pandemic of grief, essentially. It's a pandemic of grief because of the multiple losses from multiple directions, homicide, racism, so forth and so on. It is a pandemic for Black people that I think has gone unacknowledged, under-resourced, et cetera, et cetera.
Yeah, so let me say, but I'm not looking for this to lead to the need for individual type intervention.
No.
It's about community type interventions, collective interventions, which allow us to regain lost ground and go into higher ground.
Yeah.
We want to be better off than we were before, less vulnerable than we were pre-pandemic. Pre-pandemic, we were already in mental health crisis pre-pandemic.
Yeah.
More psychosis, more depression, more anxiety, substance abuse, less so with cannabis, more so with alcohol. Post-pandemic, all that stuff has gone up. All that stuff has gone up. And we need to figure out a way, without counselors, without therapists, psychotherapy, all that stuff, how do we collectively heal ourselves through our faith, whatever the faith is, and through the way we use our elders and the people in our community who have wisdom to guide us forward. I know I'm speaking off the top of my head, but you know what? Nobody has a solution right now.
This is true. This is true. This is true. But it's interesting, and I think we'll end on this note so that we don't keep folks over, because I could talk to you all night about this. This is great. But the answer lies within the collective to reach higher ground is so important. And I think when we think about community, I think we need to think about the collective resource, the collective social vaccination. I love that, by the way. Thank you for that, of community for Black folk. But we also, I think, as researchers in academic settings, need to think about the community of interdisciplinary scholars that can also serve as a social vaccination, a scholarly community engaged vaccination that can also assist with the community vaccination. I think that what you're saying, that the answer to reaching higher ground really lies within that interdisciplinary sort of practice, if you will, as well as the community collective. Yeah.
Absolutely. We need sociology. There's sociological explanations that are needed for how to address social cohesion in neighborhoods, how to build networks so parents can support each other. But then there's psychological resources that are needed, or psychological analysis that's needed. Some of the relationship problems that we have, especially the problems between males and females, but also our inability to sort of just accept all the identities, all the intersectional identities. We have a huge problem with that. And the question is why and how do we resolve it? Because certain segments of our community pay a huge price. We need psychiatrists, but we never get enough psychiatrists. There's so much resources required. So what are the therapies?
That's all right. Social work will just take care of it. I had to put that plug in. I had to.
Social workers. I had to. Social workers do have, like, they carry a heavy load in this work. Yeah. Social workers, psychologists, educators. Yeah. How do we educate our children in this modern world in order so that they can function effectively in any environment? Still be themselves as African people, understanding how some expectations are good, but some expectations are absolutely false because it's pulling them away from their cultural identities. I mean, how do we? So educators have to be involved, psychologists have to be involved. We need people who understand the criminal justice system so that we can wean the relationships our people have with the criminal justice system, where there's police, courts, bail, probation, what have you. All aspects of the system curb our potential and curb the potential of people who are involved in the criminal justice system, and actually adds to the harms of the addiction or the mental health issues that people have. And finally, we need, to understand mental health and addictions from a from the perspective of Wade Nobles, who grounds it in African philosophy and African resiliency. And when I founded the SAPC program almost more than 25 years ago, he was the person who I turned to for that philosophical context for the program.
Wow.
And how to apply the Nguzo Saba Ma'at as goals, learning goals and treatment goals, so that your treatment goals aren't just about reducing the use, reducing the harms, but grounding yourself in your people's identity, your people's culture, people's strengths, whatever they are, your name, those kinds of things.
Wow. Helping us all reach higher ground.
Yeah.
Dr. Khenti, I have to end it there, and I don't want to, but I just want to thank you so much for joining 3830 and the Crib community tonight. You had hearts the entire time going up. People were chatting in the chat, really engaged in this candid conversation. And so with that, I thank you so much for joining us tonight.
Yeah, so I led a healing circle early this week for some Black employees, and so I'll leave you with a proverb that an African proverb. I'll leave the listeners and the followers: when death finds you, may it find you alive. That is to say, may it find you living the life you're supposed to live, as opposed to finding you half dead. As a Trinidad would say, half dead. You are on a different path than you ought to be.
Thank you for that. Thank you for that. Oh my gosh. Crib community, thank you so much for hanging with us tonight. As always, we have just given you a fruitful conversation. And so until next week, as always, from our crib to yours, stay safe and keep well. Good night.
Thank you.
Thanks, Dr. Khenti.
You're very welcome.